Good morning, everyone. I'm Madican. Today, I will present my policy advocacy and synthesis on balancing cannabis legalization with stricter regulations in Thailand to ensure economic benefits, public health, and social cohesion. Thailand's shift from strict cannabis prohibition to legalization offer a unique context for studying policy impacts. Legalization can create economic opportunities and jobs, but also raise public health concerns, especially among youth. Thailand's social and cultural context and its policy evaluation make it an ideal case for examining effective regulation. By examining previous studies, we can learn how to minimize economic benefits while protecting public health and maintain social cohesion. This presentation will explore the dimensions and propose recommendations for Thailand cannabis policy. A case study on the impact of liberal cannabis policies on palliative care for terminal cancer patients in Thailand. Mr. Gopkun, a palliative care nurse practitioner, focuses on alleviating terminal cancer patient discomfort. He observed a cannabis benefit in cancer patients due to liberal policies enhancing access. Managing Mr. C, who suffer severe pain and insomnia from chemotherapy-induced nausea. He found opioid ineffective. Mr. Gopkun recommended cannabis oil with THC and CBD closely supervising its use. Mr. C experiences substantial pain reduction, improved sleep quality, and diminished nausea, leading to better food intake, increased motivation, and overall improved quality of life. Mr. Gopkun provides comprehensive counseling to Mr. C and his family, explaining cannabis benefits and side effects, ensuring informed decision. He closely monitors the treatment for safety and efficacy. This case shows cannabis effectively relieves pain and nausea in terminal cancer patients. However, knowledgeable healthcare professionals must manage cannabis use for safe and effective treatment. Liberal cannabis policies enhance patient quality of life by improving access, reducing opioid side effects, and offering robust support. Strict regulation and monitoring are essential to prevent misuse. Elevator speech section. Ladies and gentlemen, I'm Madican, a nurse practitioner specializing in palliative care for cancer patients. I've integrated cannabis extracts into my patient treatment regimens, following the guidelines set by the medical councils and the Ministry of Public Health in Thailand. This approach has significantly improved their pain management and quality of life, facilitated by current liberal cannabis policies. I advocate for maintaining cannabis legalization with stricter regulations, ensuring economic benefits, public health protection, and social cohesion. Let's discuss how we can collaborate to enhance regulatory frameworks and public education for the safe and effective use of cannabis in palliative care. Thank you. This is a historical timeline and policy analysis for cannabis legislation in Thailand. In the early 19th, Thailand began efforts to prohibit drug abuse, including cannabis. In the 1970s, under the United States pressure, Thailand strengthened its anti-cannabis laws. Between 2012 and 2016, advocates like Desha Sipat promoted cannabis oil for cancer patients. Before 2019, cannabis was classified as a narcotic with stringent penalties. In 2019, the Narcotic Act permitted medical use for cannabis. The Phumchai Thai Party, during the 2019 elections, proposed removing cannabis from the narcotic list. After the elections, they joined the coalition government and pushed for legalization with Anutin Chanvirakul as the Minister of Public Health. From 2020 to 2021, efforts to draft the Cannabis and Hemp Act faced hurdles. On February 2022, cannabis was announced no longer a Category 5 narcotic. By June 2022, it was decriminalized, allowing cultivation and sale under conditions. By 2023, social concerns led to political backlash, prompting call for reinstating cannabis as a narcotic. In February 2024, new policies were announced to reclassify cannabis as Category 5 narcotic. This timeline showed the evolving cannabis legislation in Thailand, reflecting changing societal attitudes and political dynamics. Policy analysis of cannabis legislation in Thailand. The objectives of cannabis legalization in Thailand include economic growth, improving public health, and developing robust regulatory frameworks. Legalization aims to create jobs and increase tax revenues while improving public health through medical use. However, challenges like regulatory gaps, youth misuse, and public perception issues persist. There are three main policy options. The first is strict regulation for medical use only, focusing on medical benefits with robust control but limiting economic benefits. The second is maintaining current legalization with enhanced regulations, balancing economic growth with public health and social cohesion. This approach promises economic benefits, public health protection, and social cohesion. The third option is complete recriminalization, which would reduce recreational misuse but result in significant economic losses and potentially increase illegal market activities. Balancing the aspects is crucial for the future for cannabis policy in Thailand. Based on my expertise and analysis, I recommended a multifaceted approach to cannabis legislation in Thailand. Firstly, enhanced regulations are essential. This involves implementing comprehensive regulatory frameworks, including licensing, quality control, and use guidelines to ensure product safety and prevent misuse. Secondly, public education is crucial. We need targeted education campaigns to inform the public about the safe use of cannabis and to prevent misuse, particularly among the youth. Lastly, stakeholder engagement is vital. Collaboration with healthcare professionals, policymakers, and community leaders is necessary to develop and enforce effective regulation. This ensures that the policies are practical and address the concern of all parties involved. By focusing on these three areas, enhancing regulations, public education, and stakeholder engagement, we can achieve a balanced approach to maximize the benefit of cannabis legalization while mitigating potential risks. To position for success in addressing cannabis policy and its impact in Thailand, we need to take specific steps and engage key stakeholders. Firstly, develop a comprehensive regulatory framework by collaborating with stakeholders to create clear and enforceable regulations for cultivation, distribution, and consumption. This includes guidelines for medical and recreational use, quality control, and licensing. Secondly, enhance education and public awareness with extensive campaigns targeting youth, parents, educators, and healthcare providers, highlighting risk, benefits, and legal implications. Thirdly, strengthening medical use policies by implementing strict guidelines for prescribing medical cannabis, ensuring its use only for approved conditions under qualified supervision. Establish a monitoring system for prescription and usage. Fourthly, restrict access to minors by enforcing age restrictions and banning advertising that targeted youth. Fifthly, monitor and evaluate impacts by setting up a system to track social and health outcomes, informing future policy adjustments. Additionally, support law enforcement with resources and training, foster research and development, address public health concerns with initiatives like addiction treatment and mental health support, regulate advertising and marketing, and engage communities in the policy-making process. In addressing cannabis policy in Thailand, identifying and engaging key stakeholders is crucial for success. Our stakeholders include government agencies such as Ministry of Public Health, Office of the Narcotics Control Board, local government bodies, healthcare providers including hospitals and clinics, medical associations, pharmacists and other healthcare professionals, law enforcement agencies including police departments, custom and border protection, and in educational institutions such as schools and universities, research institutions, and for NGOs, including health and social welfare NGOs, youth and family support organizations, drug prevention and rehabilitation centers, in community groups, including local community organizations, parent-teacher association, civic groups, and in industry stakeholders, including licensed cannabis growers and distributors, medical cannabis producers and retailers, and international organizations including United Nations Office on Drugs and Crime or UNODC, and also World Health Organization or WHO. By involving these stakeholders, we ensure a comprehensive and balanced approach to cannabis policy. Their collaboration help create effectively regulations, promote public education, support law enforcement, and foster research. Engaging NGOs and community groups is particularly important to address social and health impacts, ensuring policies reflect public concerns and needs. 5 scholarly laws for nurses can enact to move this policy change forward. The nurse scientist's role is the most crucial for me. Robust scientific evidence in the foundation of policy change. By conducting and publishing high-quality research on the efficacy and safety of cannabis in palliative care, nurse scientists can provide the necessary data to convince policymakers, healthcare providers, and the public of the benefit and risk. This evidence-based approach is essential for developing informed, effective policies. Author roles also play vital parts, such as nurse entrepreneur, innovates and promotes new business models and products for cannabis use in palliative care, showing market viability. The second, nurse administrator, implements cannabis treatments in healthcare setting and advocates for policy change based on collected data. And also nurse academic, educates future healthcare professionals about cannabis use, integrates into curricula, and influence public and professional opinion. And the last, nurse advocate, engage with policymakers and the public campaigns for legislative change and emphasize positive outcomes in palliative care. Combining these roles, nursing can comprehensively address and advocate for effective cannabis policy in palliative care. When moving this cannabis policy change forward, we must watch for 3 primary obstacles: regulatory gaps, youth misuse, and public perception. Firstly, regulatory gaps can lead to unsafe products and illicit providers thriving. We can proactively manage this by implementing comprehensive frameworks, including licensing and quality control. Secondly, youth misuse is a significant concern, with rising usage among young people. To manage this, We should launch public education campaigns and enforce strict age restrictions. Lastly, public perceptions issues such as misconceptions about cannabis benefits can be addressed by conducting targeted education campaigns involving healthcare professionals. By addressing these obstacles proactively, we can ensure a safe and more effective cannabis policy. Two budgetary concerns for implementing cannabis policy change are establishing regulatory bodies and funding public education campaigns. The first, regulatory bodies, require substantial investment. Addressing this by advocating for government funding with a cost-benefit analysis and forming public-private partnerships to share financial burdens. The second, public education campaigns, significant resources needed. Address this by allocating cannabis tax revenue and partnering with NGOs to leverage their expertise and networks for effective, cost-efficient campaigns. This slide shows how we evaluate and measure outcomes from the study on liberal cannabis policies, focusing on patient health outcomes and safety. The first, patient health outcomes. We observe significant pain reduction in terminal cancer patients using cannabis extracts. This is crucial and effective pain management in a primary goal in palliative care. Patients experience better sleep, reduced nausea, and improved appetite, enhancing their overall quality of life. Cannabis use also reduces dependence on opioid analgesic, minimizing severe side effects and addiction risk. We track change in opioid prescriptions to measure this. For safety and efficacy, we emphasize close monitoring with regular patient supervision to ensure safety and promptly address any adverse effects. And also feedback from patients and their families highlight significant symptom relief and improved daily functioning, underscoring the positive impact of cannabis. For policy impact, increased access. Liberal cannabis policies have made it easier for patients to access medical cannabis. We track this by ensuring patients can obtain their medication without significant barriers. Regulatory consideration. The need for stricter regulations is highlighted to prevent misuse and ensure safe use. We measure this through community discussion and policy adjustments. For economic and social outcomes, economic benefits. Cannabis legalization has created jobs and increased tax revenues, demonstrating its viability. We measure this by tracking employment rates and tax revenue increases resulting from cannabis policies. For public health education, comprehensive public health education campaigns are crucial for informing the public about safe cannabis use and reducing misuse. We assess this by evaluating the effectiveness and reach of these campaigns. For professional practice, guideline adherence. Following established medical guidelines for cannabis use is vital for successful patient outcomes. We measure this by the proportion of healthcare providers adhering these guidelines. Healthcare training. Specializing training for healthcare providers ensure they are well equipped to manage and monitor treatments. We expect all healthcare providers to receive this specializing training. By focusing on this area, we can comprehensively evaluate the impact of liberal cannabis policies on patient health, safety, and broader social and economic outcomes. Conclusion. This presentation highlights the benefits of integrating cannabis into palliative care, particularly for pain and symptom management in terminal cancer patients. It advocates for maintaining liberal cannabis policies while enhanced regulations, public education, and professional training to ensure safe and effective medical use. Thank you for your attention.